Hello, this is Dr. Gay from First Look MRI, and this is a 64-year-old gentleman who is playing tennis with his son and felt a pop in the back of the knee and some pain. So he comes in with a popliteal region pain, and the pain is not down more distally. Pretty common to see a tear of his gastrocnemius muscle here down where it turns into the Achilles. But as we go more distal, the muscle looked good, but as we come proximal, the muscle did look abnormal. The muscle is hyperintense. And we see the tendon here along the periphery, the rim. We see a little bright spot here, a little bit of fluid or hemorrhage. Looks like a longitudinal tear of that tendon. So the injury is not in the distal gastroc, like we see very commonly. It's in the proximal gastroc. So here's the medial gastrocnemius muscle. And we're going to come up proximally. This is the tendon here. This is the muscle. The muscles are going to get smaller and smaller. And we're going to be left with just tendon here in a second. And on this view, we're getting very close to the problem. Right there, I put some arrows on the gastrocnemius tendon. So at this point, normally we should see a muscle, not a tendon, but the tendon is here, which means it's pulled down, and it's also abnormal. Instead of being nice and dark like this one, let me move this out of the way. This is a normal tendon. This is the semimembranosus tendon, and the gastroc right here next to it should be the same really dark signal or low signal. But instead it looks more gray and foggy and irregular. As we go up, we see it disappear. We see a fluid-filled space here. This is where the tendon should go through here. And if we come up even higher, we should see it up here. So this is torn, completely torn, and retracted down, and this is the torn end here. He also had a tear of his medial meniscus here, but I'm going to show you another view, the coronal plane to look at this. So this is in the posterior area of the knee. This is the top, bottom. This is the medial gastrocnemius muscle. And this is the tendon here. We see the tendon is wavy instead of straight. We know that it must be torn proximally to be lax and wavy like this. As we're going up, here's the tendon. And there are some arrows highlighting the problem. This is the torn end, and it's retracted down and thickened. And it should attach way up here. So this is a ruptured medial gastrocnemius tendon from the origin. And again, it's been a long time I've seen one of these. Thank you very much.